Okay, there we go. All right, good morning. Welcome to the open house for Master of Science in Healthcare Analytics and Intelligence. My name is David Ding. I'm the program director and also assistant professor in supply chain management department at Rutgers Business School. And so I had a chance to email a few of you guys regarding today's session, but in case you have any questions or you need any clarification, feel free to read your questions as we go through the session. So the purpose of today's open house is really introduce uh, the program in general, as well as how the program might help you to develop your future career. And also, I think I want to spend most of the time posing some of the questions you might have. Okay, so for those of you who just joined, would you please mute yourself? And I think I just heard quite a lot of noises. All right. Okay. All right. Okay. So what we are going to go through today, I'm going to address three different main questions. Right? The first one is why we should start a specialty master program in healthcare analytics and intelligence. And second one is why you should choose RBS. And last one definitely is once you're ready, excuse me, how you can get started. Okay. So about myself a little bit, and I joined Rutgers Business School around a little bit over 2 years ago. And prior to Rutgers, I was at Penn State and the University of Houston. And so my research and teaching interests are pretty much in the application of operation strategy and data analytics in healthcare. And so since I joined Rutgers, I have been directing the program. And the program was initially tailored more towards executive management education, and it would under the healthcare service management title. And since I joined Rutgers with input from industry as well as organizations and hospitals on our advisory board, as well as the business school in general, we decided to convert the program from general management executive training over to analytics focus with the application of data analytics in healthcare. All right, so we started with our first cohort and the new program structure um, this fall semester, and we're looking forward to grow the program. So far, the demand for this major in the industry has been increasing dramatically. And I'm going to elaborate a bit more about the application and how, what kind of job positions that students might be able to get after graduating from this program. All right, and so I'm also going to talk about a little bit more about our faculty members and our students population as well. Okay, so first one, why we should choose this program, all right? And so this is the general landscape for healthcare. If you have been working in this industry before, it probably you already get a large picture in general. However, if you have not, it's a good time, to dive into this industry to looking at what the problems, issues, and how we might be able to leverage this major in order to solve those issues in this industry, right? So first of all, we are running into an aging population, and in the next 10 years, over 1/5 of the population in this country will be above 65, right? And so um, with those aging population, there's a huge need for us to deal with the complication as well chronic diseases. And so that's why we are seeing a surge in our costs associated with healthcare. So United States is the nation spend most percentage of GDP in healthcare. And we are going to spend over 20% of GDP in healthcare moving into next year. And that equivalent to $5.5 trillion. Okay, but if you compare it with other countries such as the UK and France or other different developed countries, they spend a much less GDP, on healthcare in general. At the same time, their average operating margin for nonprofit hospitals in the nation is 1.8%. All right, so what does that mean? So if we compare the operating margin for nonprofit hospital versus some of commercial companies such as Amazon, such as Tesla, the average profit margin or operating margin is in 2 digits, is above 10, it's above 10 to, or around to up to 30% for a lot of those commercial companies, right? And so at the same time, if we're looking at how patient is happy about the service received from hospital or from other care providers, and if we range from the very unsatisfied as a 1 and very satisfied to 5, the average patient satisfaction is 3.4, right? If we put the context of this satisfaction into your general shopping behavior, so for instance, you shop with Amazon or you shop with other third-party vendor, and if your satisfaction is only 3.4, most likely you probably want to switch to another better vendors, right? And so, so if we put in that context, you can't understand, some of the issues or problems we're running into here. And lastly, there are close to 500,000 people in the United States died in hospitals each year or other care settings due to preventable human errors. So what that means, we spend so much money in this specific industry. However, it looks like that still quite a lot of issues we're facing in this industry. There's still quite a lot of rooms for us to make improvement, right? And so that is the current status quo for the healthcare system in the United States. And so if we just stay on this page, actually we can talk a lot of different things. We can talk about, well, how we can address a cost issue, how we can better improve the efficiency, how we can improve patient experience, overall satisfaction, and also how we can reduce the number of errors that we see in the healthcare industry so that we can reduce the number of people died each year in this industry itself, right? So that drives to some of the trends and opportunities we can see in this industry. So first of all is the big data, right? And I share slides, but if you're looking at the big data in general in healthcare, we can looking at the patient information stored in the electronic medical records, which essentially is a software you probably don't have a lot of time to interact with, but whenever you saw physician or nurse practitioners, right, oftentimes they're talking with you, they type in information in a computer, and those information are stored in what we call the electronic medical records. It's a huge database tracking all the patients' bios, the medication history, the number of shots they've been getting, the different images that have been using. And that is just one part of the data. And then there's also huge data dealing with insurance claim. Whenever you finish check in, check out with a physician, and you get the bill from the insurance company, and those information are also being stored with the insurance company's secured website, right? And with secured storage. And there's also a lot of other information such as the medication, such as the drug, medication informations from the pharmaceutical industries. There are lots of other information dealing with the public health information, for instance, the health disparity and the access to healthcare. So we have tons of different data in the healthcare industry. But how we can consolidate all this data and then drive some insightful information that could be helpful for patients, for care providers, for any other organization in the healthcare industry, that is the trend that we are seeing in this industry. We're not there yet, and however, that is what we are moving to. Okay, and within the healthcare industry, there's also a huge industry shift from what we call the volume-based care, which previously, if a care provider see more patients, they get more reimbursed. Right now, we're moving into the value-based care, where they have to demonstrate the value, the efficiency on the patient outcomes using the treatment they prescribe to the patients. Right? So that is one of the huge areas opportunities in the healthcare industry, which is on the big data and healthcare analytics. And the second one is, if you probably heard the term of the triple aims from Obama's administration. And essentially what that triple aim is looking at how we can actually provide care to patients, ensure they have access, ensure we have good quality. At the same time, we deliver care efficiently. And so that is a multi-dimensional matrix that is somehow being reflected in the value-based care in the previous components as we talked about. And then moving forward also, oftentimes when you seeing a doctor or when you lead care, oftentimes the care is delivered in a team setting. What that means is you only just see the physicians themselves. You also get interactive with the staff member, nurse practitioners, sometimes technicians, right? And so sometimes social workers. So in that sense, we're looking at the healthcare is not just a one-to-one relationship between the patient and the physician, rather is a team-based care. And that needs a lot of collaboration for all the members who are involved in this process. So that involves the leadership and potential project management as well. And next is advancement of process management. And process is one of the very much foundation of healthcare. If you think about the way you check in, check out from the clinic, from the hospital, there are tons of different processes involved, right? How you check in and how you're going through the triage process, if it's an ER scenario, and how you're getting billed by an insurance company, how the physician prescribe medication or treatment based on the symptoms, based on your previous history. So that a lot of different processes are embedded in the health industry. So one of the things we are learning from the health industry is using quality management or continuous improvement process or Six Sigma, I'm sorry, and to enhance the performance by looking at the process themselves. A last one is the extended supply chain. And this is not a traditional way for us looking at supply chain because for some of you who have been in supply chain industry, you might think this is essentially the wholesaler, distributor, and the consumers, retailers. That's a general supply chain. But in healthcare industry, we're looking at the demand, the supply chain, and supply relationships. A lot of those demand are driven by us as patients. And that once there's a demand from us, we need the care and we need to see physician, we need a process, we need a treatment, we need imaging services. And then there are a lot of service providers, right? It could be the healthcare service providers, imaging center, outpatient center. And they're also part of the pharmaceutical companies where they provide the drugs, right? And one of the things you saw right now with the vaccine, there's a lot of discussion in terms of, well, since the Pfizer vaccine need ultra cold for delivery, it needs to be below 80 degrees. And how can supply chain be able to accommodate such requirements and ensure timely deliverable? So that's pretty much a lot of different trends, opportunities, and we can go on for quite some time to talk about other opportunities, but I think over here, the slide kind of highlights a lot of opportunities we are looking at, we are facing in the healthcare industry right now. And that's all some of the issues that we need a solution, right, and from this industry. So what is healthcare analytics and how we position this program and how this fit into what we talked about in previous slides in terms of the trends and opportunities? Right. So you heard about data scientist, and it's a very cool discipline and a very interesting job they're doing, which is essentially the dealing with the data acquisition, data manipulation, programming, applying this programming advanced statistics to drive some results. And we also know that there is another aspect, which is essentially the stakeholders who probably have nothing to do with the programming, knows nothing about program coding, but they have the issue problems they need to solve, right? The executives need to get a strategic decision, such as, for instance, under the COVID, and right now we are in the second or even the third surge in COVID. a lot of hospitals are running out of the capacity in terms of ICU beds. So a strategic decision is, well, what can we do, right? And to dealing with the ICU bed shortage and the medical supply shortage. And there's also middle management operational decision in terms of on day-to-day operations, right? How we deal with the shortage of nurse practitioners, how we deal with the shortage of PPE supplies. And lastly, the client, they also need to have information. For instance, for us as a patient, before we go to see a doctor, physician, most likely you want to check how they have been performing, right? Looking at the different ratings, different reporting performance metrics that have been sharing on the website, looking at other patients' kind of complaints or recommendations. So there are tons of different information that stakeholders need. What we saw from the industry is data scientists are very good at manipulating the data, doing the program, doing the coding. However, oftentimes they have difficulty communicating what those results are and how those results might help to solve issues or problems the stakeholders have, right? And so that's why we feel there is a potential, there's a strong need for healthcare analysts. Okay, and there's not only, probably it's not only under the title of healthcare analyst, could be data strategist, could be the data analyst, could be data engineers, all right, and they could end a different title. But what they need to do is, in order to connect the data scientists and the stakeholders, they need to know the database itself, the data structure, right? And how this data is being collected and what is the meaning of this data, different labels. And they also need to understand how to apply analytics. We're talking about a little bit more application of different software and the different programmings. And they also needs to have intermediate statistics, because once they have the results from data scientists, and then they need to report it back to the stakeholder, and they need to know exactly what does this mean, right? And how, whether what is this percentage mean, and what is the value mean, and how we can build on this data and to further make improvement. And so that is essentially something they need to know for sure. At the same time, what makes this professional a little bit more challenging is they need to share certain component with either side. They need to share the intellectual curiosity and the data structures, statistics programming with the data scientist, because they're not just taking whatever information from data scientists and feed it to the other end. Rather, they need to work together with the data scientist to refine the results, to drive down a little bit deeper into the data by itself, and apply a different model to find a solution. And on the other hand, the also needs to have the business knowledge about this industry, knows why they're doing what they're doing, and they needs to be able to visualize the results, because a visualization or the dashboard per se is what has been driving this industry. If you think about, for instance, if we are working in the industry, for instance, either as the executive members or the manager for a unit, right? Be able to see what is going on the dashboard right away. Understand, for instance, what is the shortage of a PPE? What is our utilization of ICU bed? And and what is our current inventory storage of different drugs we have on hand? To have such information on the dashboard, on the fingertips per se, and that will make a huge differences. Because right now, what we are saying in the industry from the COVID experiences, a lot of this information are not transparent. And a lot of this data are buried underneath many different layers. In order to dig out those data, it just takes time. And by the time the data is being digged out, being presented, is already a couple of days later, probably even a couple of weeks later. that.
David, I'm not sure if you want us to hold the questions until the end, or I was just curious about something. Is it okay if I ask a question?
Yeah, sure. Go ahead. Yes.
Yeah, so I do have some experience working in so my name is Hina and I'm currently at Johnson and Johnson, and in my last role I was a part of the customer solutions team,
Uh-huh.
primarily working with all the large IDNs and healthcare systems,
Sure.
actually a lot in the healthcare space here. So what
Mhm.
kind of challenges in your experience have you faced in terms of having hospitals collaborate with you trying to get that data? Because there's a lot of like
Mhm.
healthcare compliance
Yep.
type of activity that occurs there. So how does that work? Can you talk about that a little bit?
Yes, most likely working with hospital, getting the data involve quite some process. It's not that straightforward because of the HIPAA, right? Because probably you're aware, but the patient privacy related issue. So most likely you have to be an integral part, or you have to be somehow uh, be sort of integrated into that processes in order to have access to those data. So what most likely what we are doing right now is we working with hospital systems or IDNs, and we provide our skill sets, and they have specific questions, for instance, issues that need to deal with. Most likely is that's two ways up for collaboration, right? If you try to drive into the general solution, and most likely you can eliminate the patient's information. And that is a way to somehow get around with the HIPAA regulations. And however, still there's a not a little bit more contract terms that we need to develop with the hospital systems. It's not that just plug-in process. It needs to certain type of supporting contracts you have to sign in order to get the data. However, if you are going to really get into the fine degree level in terms of the patient level with access to patient information, then that involves a little bit more, how to say, legal processes that you have to go through. So for us, I guess from Johnson Johnson's standpoint of view, you might face different challenges. But for us, what we are trying to do is we as Rutgers universities need to sign uh, legal agreements with different hospitals or IDNs or hospital systems. So once those contract has been signed, as this legal agreement has been signed, and then we can, for different programs that we can work together with that specific IDNs and own the data sets. However, it's only under the premise, under the assumptions that, and most likely we will have to go into the facility and stick with the data regulation requirements with those facilities, and work with the team members, and then to drive some of the solutions for this database from those data from analytics standpoint of view, right? So that's kind of two
Gotcha.
ways, right? And but I don't think it is a single solution to you. I
Yeah.
understand your challenge because
Yeah.
I faced the same challenges before.
Hmm.
But if you are interested, we can definitely talk more after this session. All right.
Yeah, absolutely. The reason I ask is I've seen two sides of it mostly. So once like the, just like the hospital level PPE, and like there's a shortage, or if
Mm.
there is enough, they don't know, exactly where it's located within the hospital with
Mm.
the sales reps. Or the other side would be that like it's at the patient specific level when you're trying to get a specific type of knee or,
Right.
very specific product for them. So
Right.
I'm just
Right.
trying to,
I think a lot of times it really matters who you're talking to. A lot of we are working quite a lot of different IDNs, and I think
hmm
be able to working with the data analytics unit. Most hospitals or IDNs actually have the specific data department or analytics unit, and if you are able to work with them, most likely it might be more efficient, for you to answer, because you're looking at the data governance structure, the one you're measuring, right? Because the data is not just isolated. Most likely it's being integrated into certain aspects, certain department, and it has different type of interfaces. So that is a data governance structure that I don't think we have a lot of time to talk about it. But getting to the right person, understand the data structure, understand what's the limitation, and also whether under the HIPAA regulation, what you can deal with it, and you will have to talk to the right person in order to really be able to break through. Okay, but definitely we can talk more after this session.
Yeah,
All right.
thank you.
You're welcome. And I think another aspect for us to looking at why this profession could be challenged is also really communication part. And we are saying that communication is really, I would say, is kind of a very fundamental skill set that analytics professions need to have. Because if you cannot really communicate what this result is, and how this might be able to address a question those stakeholders have, then essentially those analytic professionals will fail miserably, right? So in that sense, it's not just in your general how the way you approach people, you talk with people, you communicate with people, but to bring your business knowledge, your analytic skill set into the communication processes and present large picture, present the direction to the stakeholders. Right? And so that is the challenge part that we have seen many times when we're talking with professionals in this field. All right, and so some definition from Deloitte, you can see that analytics in general is not just in working on the data itself, is actually is much broader than that, right? And we need to use different technologies, methods, and of course, analyze data is one component of it, but eventually what you want to do is really to deliver the insights and tell people why you're doing this and what is the result out of it and what decisions that might be driven by this data results, right? And so I think that is the fantastic kind of a very interesting aspects by looking at what this profession can do, right? You can make a difference. So that is very important. And so job market of healthcare analytics, and if we're looking at the different aspects of the jobs, potential jobs, one aspect we can think about is for the financial aspects. And we have our alumni from our program who is part of the VP. She right now is a VP with United Health. And basically, she was giving us a guest speaker as a guest speaker a couple of weeks ago for our program. And so she was talking about, from the claim aspects, right? And they receive hundreds of thousands of claims every month. And they have to screen through those claims and make sure those claims, those code or this DRG essentially is it's kind of a diagnosis code that we're using for reimbursement purpose. They're trying to looking at out of those hundreds of thousands of claims, what are some of the claims much subject to fraud, all right? And what some of the claims much subject to issues need to have a correction. So if you're looking at the volume of those claims, right, hundreds of thousands of claims, and from different patients, from different healthcare providers, different physicians, and that is quite a lot of work for them to deal with. And then revenue cycle management, that is more coming from the care provider standpoint of view, and how to make the ends meet, and also the payment integrity, fraud, waste, and abuse. And so that's kind of, if you are really interested in the finance and accounting aspect of that one, there's a lot of data that you can process from there. And then if we're looking at the operation administration on day-to-day basis, right? And PPE, and which essentially everyone knows right now, really how to see where the PPE are, what is the consumption rate, excuse me, and when we're going to run out of this PPE, it's not just one PPE, right? You could have the N95, you have the surgical masks, and then you have the gowns and different sizes and, probably different colors and have different filtration, ratios. And dive into that by itself is also another very interesting aspect to look at it. So I'm working on a project, or I have been working on a project with a university, with a hospital. And we're looking at the number of different products, the medical equipments or medical supplies that have been using for a small unit within a large hospital system. And within that unit, they have been consuming a lot of different medical supplies. But just for single supply, the specific type of supply, they purchase the same products from 10 different vendors. Well, sometimes it's just a preference from physician that they prefer the brand, even though it serves the same purpose, it's exact the same parameters. And we're looking at that data, it bringing a lot of discussion in terms of, well, how can we streamline the process, right? And eliminate a lot of duplicates and consolidate a lot of supplies from a single vendor, in that sense that we can reduce the error in our supply chain and getting the volume discount from the vendor. So that brings up a lot of different opportunities for us looking at as well. And of course, database administrators, as we talked about, there is a huge patient records. It's also a lot of other data we have to manage around. And then moving to clinical aspects, then there's a lot of potentials for looking at the quality improvement. And if we're looking at over close to 500,000 patients died in hospital due to preventable human errors in the United States, right? And how we can looking at what happened, why patient was in inpatient units, right? And what the process went through, and what quality metrics we can use better to gauge the overall performance so that we can try to reduce the number of errors. We can save more patients' life, right? And also the Medicare and the health services, and we're looking at the imaging service, the pharmaceutical service. And so those are the service components around it. And reporting and compliance is another very important aspect. And the last one is comparable analytics and effectiveness. And government agencies, Center for Medicare and Medicaid Services, has been really pushing forward towards compliance. We're under the value-based care model, which is a new model that the whole healthcare industry is adapting to right now. Compliance is the key, where the process stick with the best practice, whether you're not running against the protocol, and whether you are using the medication, the medicines that has been shown has the most effective, what the highest efficacy. All right, so that's all the different aspects that we have the data tracking, right, and how we can make use of the data to ensure that care providers can make improvement over time, that patient can have a better outcome as well. And last one is population health. And this looking at, if you're looking, I have a slide to share, I'm going to share with you in terms of the current progress with the COVID. And that is the COVID, in general speaking, we're saying it's actually a crisis for population health. Why we're saying so is because there's a lot of things can go wrong, right? And if, for instance, if people don't follow the social distance guidelines, don't follow and stay at home, the policies, and and don't report themselves, and that could cause a chain effects. So from population health standpoint of view, and we have students actually working on the tracking patient systems right now with the state government. Essentially, they're tracking, the travel histories for patients and the type of interactions they have been having with other people. And once this patient has been diagnosed with a positive COVID, and then the tracking system needs to kick into play, right? And it's tracking. So does these patients really bring in potential threats to the neighborhood, to the community? And what we can do to intervene, right? And so that's all the different type of aspects. There's a lot of huge data. Most likely those data are kind of with a specific location and with a timestamp and with a lot of different information. And how we can work around those data and try to help us to build a better systems tracking the COVID and prevent COVID. That's another very important aspect for us to looking at as well, right? Some of job titles for people coming out from this discipline could be just general data analyst, data scientist. It depends on how much programming experience you have or how much you like programming in general. And the business intelligence analyst, and manager analyst, healthcare economics, analytic consultant, system administrator, healthcare service manager, data strategist. Okay. And so one aspect for looking at this profession is there's a lot of increased demand for consulting opportunities. a lot of those consulting companies right now are hiring healthcare analysts to help them to manage and get into the healthcare industry as well. All right, so very positive side, very promising major. If you're looking at the trend for how this industry is shifting over time, and between the 2019, which is last year, towards the 5 years or 4 years down the road, this industry is going to increase by 5-folds, right? And so if you're looking at that is industry that you really want to be in. So one aspects I really want to bring in, I want to talk about also is, if you coming from different industry and you feel that you don't know this healthcare industry very well, but you are interested in doing so, and a lot of times, a lot of those problems in healthcare industry needs to be solved by outsiders. Why I'm saying that is just because, just taking one example, right? Healthcare industry is very unique, and the way for us to really adopt electronic medical records, which is essentially the systems that digitize patient records, it took us more than 10 years to get to what we are here right now. If he's putting this in another industry context, such as the supply chain, such as other industry, this could never happen. If any companies spend so much time to just to digitize everything, they're going to die. They're not going to survive in this industry, right? So that's not a very unique aspect for this industry. But sometimes we need a push from other different industry, from people who has a good understanding from other industry, bringing the expertise and also integrate with this industry very well and to find a solution. Okay, so if you are coming from other industries, I think definitely this profession will open a new window for you as well. So this is what we are. I just got this picture this morning, and this is what we are facing right now with the COVID, right? And you getting exposed to all the different news and the headlines related to what has been done not so well, what has been done well, but that's what we are right now. And even though the vaccine is coming out, and but a lot of people, a lot of experts are saying that we probably have to live with COVID in the near future. Okay, and but if we just using this as a context, right? And you saw all the news, hospital are getting overwhelmed, and physicians, practitioners working overtime, and we're running out of PPE supplies. And this is early on, right? When the COVID-19 sampling site opens up, and the miles of traffic, right, not in front of this testing site in order to get it tested. It's kind of crazy, right? And if you think about it, once you need this testing, you will have to wait for hours in your car. And how could that really speed up the process to really having, how to say, help us to understand exactly what is status quo, right? And we have millions of people needs to be tested, but we can only test thousands of people per week. How could we cover all those people who need the testing, right? So that was one of the big issue at the beginning of the pandemic. And right now, this again is the early picture looking at the different trials, clinical trials, this kind of the pharmaceutical companies are trying to go through. And luckily, we got 2 very good vaccine up to this point. However, the process to getting this clinical trials, stage 1, stage 2, and stage 3, and completed, and with sufficient efficacy numbers to show to CDC. And that was amazing, right? And that was a process that the industry has not gone through before at all. And so they're renovating, they're kind of come with creative ideas to speed up the process. So that's all the different news that you have saw before. But if we're looking at, in general speaking, how healthcare analytical intelligence can apply in this context, right? So first of all, triage process. As patient being admitted into a hospital, right? And how we can go through the triage process a little bit differently, because we want to isolate patients who are positive, who are COVID positive. with other patients who are trying to go through the elective surgeries, and how we can isolate those patients, right? And that becomes a very big challenge at the beginning of the pandemic, okay? And so that is what essentially we're looking at the descriptive kind of analytics, right? Essentially whether you has been identified as positive and how we isolate this patient from others. And the second one is predictive analytics. As time go by, you can see we have this number of cases increase over time, right? And at the beginning, and at that moment, how we can secure enough number of staff members and make sure they're trained. And so one of the things that we have been doing over the pandemic is to train non-ICU physician and the nurses, right? And to make sure that might be able to help in the ICU units, right? That's kind of the very important training process. And how we create the designated beds. And so a lot of hospitals, when they're running out of ICU beds, they're trying to, utilize other non-ICU beds to convert them into negative pressure rooms and using them as ICU beds to treat patients. And how to managing the different supplies, how to deal with the cancellation of elective surgery. And most hospitals suffer, actually lost over 80% of elective surgery patients during COVID because patients are not comfortable coming over during that time. And how can they deal with the cancellation of these issues and rearrange, reschedule these surgeries so that it can ensure that patients' care is not being discontinued. At the same time, they have enough revenue coming through over time, right? So that's all different numbers we can deal with, all the different analysis we can deal with. So this is what we talk about as a predictive analytics. And then the next one, dealing with the treatment processes, right? And how to go through the clinical trials and how to really boost up the production of the testing kit as well as the vaccine right now. So that is what we call the prescriptive analytics. And last one, population health, and how we identify the transmission pattern, population at risk, prevent outbreaks through the quarantine, travel bans, and business closures. So that by itself is a huge subject to study as well. So that could involve quite a lot of machine learning and try to develop a certain type of prediction of the patterns based on the data we have, right? And so altogether, if you're just looking at during the current pandemics, what we can do as a profession from healthcare analytics, there's a lot of we can do. And there's a lot of demand for what we need to offer to this industry as well, or for the general population as well. So I hope I gave you enough kind of information, talk about the importance of this major and the importance of health analytics and intelligence. So why we need to start this program in our years, right? And so I've been with business school for 3 years, a little bit over 2 years. And this is one of the best institutions I joined. As I mentioned, I've been with the Penn State and University of Houston before. So we do have the first-class faculty members, and we also have a very engaging staff members providing service. And we have very, very high-profile students populations in the program as well. So how is this program unique, right? And the program in general is designed for professionals who are really interested to develop their own competitive advantages by applying different analytics tools. Again, we focus more on the application of healthcare analytics or analytics in the healthcare setting. However, as we get into the curriculum, we can talk about if you're interested in programming, there's a lot of way for you to boost up your program skill set as well, right? To create the data-driven solutions to very complex problems in the healthcare systems. So the curriculum consists of 36 credits, okay? And we are STEM accredited if you're international students, and this is really a very important designation for you because you will have extra time to practice what you learned in the curriculum. And we do not expect students to have a lot of exposure to healthcare industry before. As I mentioned, to solve problems in this industry, we do need to bring in a lot of expertise from other industries or a lot of other information from other industry as well. And it depends on your qualification. If you have taken graduate programs before, if you are PharmD or MD, and or if you have up to have a minimum 5 years working experience, we can waive or and transfer up to 6 credits into this program. Okay, and lastly, this is not just a program offered from a single department. Rather, we collaborate with a lot of other different units, programs, even colleges, schools, within Rutgers systems to co-develop this curriculum. All right, and we focus on developing students' knowledge base in healthcare and the skill set in business analytics. And also, as a business school, we want to develop students, business skill set or acumen as well. All right, here's a team. And so I'm a program director, and we have a lot of very seasonal professionals from different aspects of healthcare joining us in the program. Josh Agresta was a VP for Johnson & Johnson. Resnick was a principal at Deloitte. Michael Crocker was a VP with the Bayer. And Katriana is currently also working as a program coordinator with us and help managing students registration and a lot of students issues as well. So that's pretty much a small but very collegial teams that we have here for this program. Okay, most of questions that for some of you guys probably can't be answered by just looking at the curriculum itself, right? And so we have a couple different core components, right? First one is the core for the healthcare. And so we have a list of different options. Students choose up to 3 courses of this core to fulfill 9 credits requirements. All right, and so as you can see that most of those components in the healthcare core give you the foundation in terms of either the business model or the health system is operating or the different managerial issues that we need to deal with in this specific industry. And then there's a small business core, which you can select the 2 courses out of those 4 different option courses. And it depends on whether you want more moving to the process driven, Lean Six Sigma, or you want to really understand how project management can be applied in the industry. And you can choose out any 2 out of those 4. And the next one is our analytics and intelligence core. And this is a very important component for this program. And so we want developer students understanding for statistics, application of analytics, database structure, decision-making process, visualization, as well as some of the intelligence component out of it as well. So students will select the 4 courses out of this 12 credit, out of this 8 different options. Lastly is the internship and electives. So what we are trying to do in this program is we require students to either doing industry client project, which is 3 credit course, working as a team to solve actual problems for one of those industry clients from the program, or they took internships and which has run through 3 months is a list. And, we're using this a way to make sure students get a chance to practice before they graduate. It's also good ways to put that experience on their resume. And also, depending on students, the qualification, where they come from, they can choose to know more about healthcare, or they can choose to know to learn more about business, or they can choose to more dive into the programming or the even the computer science aspects. Right? So we develop this curriculum. We want to it be more open rather than closed format. So depends on where you come from, what the industry experience you have, what training education background you have. We will be able to customize the curriculum just for you. Okay. So I want to speed up a little bit. So some of the different options students can go through. The first one is the fast track, where we suggest students fast track to go through 3 semesters to wrap up the course, the program. And it's not easy, I can tell you, especially if you just graduate from undergraduate programs, you want to pursue a graduate studies. And it's quite a change in terms of requirements, because we're more looking at not just how much you memorize, but how much you can apply, right? It's more a little bit more advanced level of testing how you understand, you master this knowledge, and you might be able to apply. Okay, so the fast track oftentimes will be able to get done in 3 semesters, and the regular formats for, I would say, for around 40% of current students are in their part-time formats where they have the full-time position and they want to really learn the material well, but they don't want to have too much conflicts with the working schedule. So they pick up 2 courses or up to 3 courses per semester. They finish their course and they finish the program in 2 years. However, if the students want to spend more time, need more time to finish a program, we can offer up to 5.5 years for students to really complete the program studies. Student profile, and so far 35% coming from healthcare, could be hospital care provider setting, could be other healthcare service related components. And we have 17 coming from analytics backgrounds, who are either from analytics backgrounds from the training or analytics backgrounds from the current profession. 7% farmer backgrounds, and then 39% are following others. Others means it could coming from other different industries or coming from other different domains. General profile, years of working experience range between 0 and 10 years, average GPA 3.2, range age, and we have some are very fresh graduates from their undergraduate program up to some of the students who has been practicing in medicine, has an MD title, and for many years, or some nurse practitioners has been practicing for many years as well. Backgrounds in business science, healthcare, IT, right, and some placement. I did not exhaust all the list because I just want to show you some of the highlights. So students can go to specific healthcare providers in these scenarios. They can go to, for instance, Johnson & Johnson could be one of the employers who hire out students. Robert Johnson and hospital systems or IDNs could be one outcome as well. And so that's a small cohort. And some of students actually really want to do the consulting. They do not want to limit to certain type of specific, for instance, hospitals or the companies, but they want to working with different companies through the consulting experience. And they go through the specific consulting industry, the consulting companies that are focused in the healthcare. And some of students who have the prior medical training, MD training, and they actually went over to some of the university hospitals or some of the universities under the medical units as either faculty members or faculty practice managers as well. All right, so that's a couple of different type placements. And so how to start the next process, right? And so I'm going to open up the question very soon. I know some of you guys probably have tons of different questions. I can use in QA time to answer your question. But basically, the general process for us to go through is there's a $70 application fee, but I believe admission office might be able to waive this for you since you're joining the open house today. And the 2 letter of recommendation, and what I suggest students to do over time is find a letter from their employer. If you have been working in the industry, right? Find a letter from your current company, and then at the same time find another letter from the professors that you worked with before. So we want to evaluate, your academic performance previously, as well as your capability in your current working positions. So ideally, if you can get 2 like that, that would be great. However, if you just graduated, and the most likely you probably can't get in 2 letters from the professors, but if you have interns or part-time jobs, we would love to have some letter from your previous employers as well. Okay. Personal essay. This is a very important component because I'm reviewing a lot of different applications from different backgrounds. Most likely what we are trying to look at is how the students fit in this program, how this program might help this person, to achieve, his or her next level of careers. And we want to develop students who will be able to place in the market successfully. And so from the person essay is most likely is for us to judge, well, does it make sense for the students to be placed in this program? and how we might be able to help the students, okay? And transcripts, of course, and the GRG-MAT. So we understand the current situation with the COVID, and we do offer waiver, but if you need to waive the requirements for GRG-MAT, we do need to evaluate your qualification, and you need to contact us, get in touch with me, and send your resume as well as your transcripts from previous universities. And we will have to using those two to evaluate whether we might be able to grant GRG-MAT waiver to you. All right.
So Dave, for the, I'm sorry, just quick question on the GRE GMAT part. So I was gonna take my GREs this year, but unfortunately could not because of COVID. So what kind of, I guess, like qualifications or considerations would there be in order to get it waived?
So I think we're looking at the GPA and from previous schools, right? And we also look at your current working, if you're working your overall working experience.
Right.
And we use those two altogether to evaluate.
Gotcha.
So basically, what we're trying to make sure is we want to make sure students in this program will be able to succeed.
Okay,
right?
awesome.
Not just academically, but also professionally. So that's something we want to do, because we want to build, we want to push up the ranking for this program. We're not yet goes through the ranking because our new program just rolled over this past fall semester. We want to move up the rank because Rutgers is one of the top institutions, and we want to build the top programs in the nation as well. And of course, I can't give you a lot of sales pitch, but we are one of the few healthcare analytics graduate program that are offered not online. I'm not talking about online, because if you look at online programs, there are quite a lot of different options. We want to develop this professional network for students, help them to connect with other students in through a little bit more hybrid formatting, which is offline plus online. And we are a STEM accredited program, which means there are enough rigor in our curriculum development, and which needs to go through the state government for approval, and also the federal level for approval. And we are also one of the few programs that is hosted in business school and looking at healthcare application, the application of healthcare analytics in in the healthcare industry. So we can talk about a lot about that, but I think in order to getting the waiver, so we just want to make sure students will be successful. Okay, and then for international students, TOEFL or IELTS is required, and there's no way to get around it. Last one, resume. And in order to, before you send a resume, please do make sure update your resume with your most recent either employment history or your degrees or some qualification you earned. So that will really help us to evaluate your application. Okay. So for students who are currently undergraduate, especially in supply chain program with RBS, we do have this accelerated track where for students in the senior years, they can take up to 6 credits from our graduate program upon admission into a program. So if you are interested in this one, let me know. And I'm not sure how many audience in today are falling into that category. But if you know someone who are interested in this as well, please help to spread the word. And we have a few students who are going through this program right now. So last one is a certificate program. I do not promote this program at this moment. So this is more from our previous program structure, where if you're not yet ready to start in the program as a degree students and you want to use a certificate as a way to try it out, that's completely fine. And this is a 12 credits. And so the admission process is very simple. And we have a separate application for this. If you're interested, I can share that with you. But basically, you're going to take 4 courses and together with our program students. So even though you are not obligated to finish all other courses, once you finish these 4 courses, you get a certificate from a business school. And if you're later on interested in pursuing the degree studies, we will transfer all those 12 credits into your degree program. And however, I want to mention that we have the same requirement standards for students in our certificate program versus our degree students, because essentially you are taking courses all together. And in terms of the preparation for proficiency, there's a proficiency requirement for any students, graduate students joining the academic school, which is essentially you need to have a prior exposure to statistics and calculus. And if you have not, you need to take the module to earn a pass grade for that module. Or if you are taking prior statistics and calculus courses, you need to earn B or better grades in order to pass that proficiency requirements. Okay. So this certificate option is only applies to students who already graduated. If you are still undergraduate students, you will have to wait until graduate before to apply either certification or our degree program. Unless you are RBS students, you can go through our fast track options. Okay, student testimony. Those are the a few students that graduated, and I do understand that I did not including our lovely female students. Unfortunately, it was just during my design of slides, I did not put them together, but next time I'm going to update it. So they are placing at different places that you can see. And the first students had the MD training, and he's right now is the practice manager for faculty members, Columbia University. Second student right now is with a media data solution consulting company. And last students right now is a project manager with United Health. And so from the testimony, you can see that our program is kind of unique, where we're looking at application of healthcare analytics, and we're looking at developing students' knowledge base in healthcare, the skill set in analytics, and also we want to develop students' management or business skill set as well altogether, because we think those three altogether really going to make you a successful analytic professionals in this industry. Okay. Lastly, it is Michael Berger, is a chief data and analytic officer for Mount Sinai and from New York. And so as you can see from his quotation, there's a huge demand for professions who understand the data analytics, who also understand the healthcare industry in general, right? And so our program is actually created to fit into that gap. If you still recall the initial slide, I showed you three different circles with how the healthcare analytic profession fit in between. That is exactly what we are moving into as a program. That is also what exactly the industry is looking for as well. Okay. So with that being said, I think I'm reaching my 1 hour mark with I just spent 5 more minutes for that. I'm going to open up the questions. So if you have any questions, feel free to ask me right now.
Dr. Ding, could you go back to slide 24, please?
24? Okay, sure. Yep. So if you sign up for their open house, I'm not sure whether I have access to your email information. If you want a copy of these slides, or I'm recording this session right now, so I'm going to post it on YouTube. So if you want to have access, if you want a copy of that recording, you can just leave your emails on the chat box. So once I finish uploading the slides or uploading the YouTube, I'm going to send the URL to you guys so you can have a copy of that.
Hi, thank you for the presentation. I just have a quick question.
Uh-huh.
I want to know, how strong do you need, does your computer science background need to be in order to be successful? Like if someone doesn't have a computer programming or a computer science background, but they come from a business and a strong mathematical background, is it going to be an uphill battle, this course?
I think definitely we actually right now I think we have over 50% of students coming from business backgrounds. Either they have business in supply chain or business in marketing, and our business in MIS. I don't think that's going to be a problem. So we do not expect students to have a heavy duty programming experience prior to join the program, but they should be comfortable to learn some of their programming skill set. For instance, we do expect students to learn R and Python through the program. And however, I want to kind of reiterate, our focus is not to develop computer scientists or data scientists, but students do need to understand this programming, how this program worked, and be able to, for instance, read some of the codes, be able to run some of the codes, be able to do some of the troubleshooting of the codes, because eventually those skill sets will be required by employers, right? And so, but again, we are more focusing on the application and the application of the programming, application of different, for instance, Microsoft, uh, kind of a visualization, different visualization packages, or uh, um, some other different softwares as we talk about. So some of the softwares, most of the courses in this program will teach you ranging from the database management, ranging from programming, ranging from the visualization aspects of this profession. But if the students are not willing to learn these subjects, then that's going to be a problem. I don't think I see any students in the program right now running into that issue, but I want to be upfront where we do expect students be able to apply different software and be able to do some programming, even though not heavy duty, and because that essentially is what the industry is looking for at this moment.
Gotcha. Thank you.
Yeah. Okay, you're welcome. So I got a few of you guys send me the emails on the chat box. Thank you for that. I will definitely take those information. I will send you guys the links for the recording for sure. Okay. And sometimes if you have a specific question, for instance, if you want to talk about your specific qualification or any doubts you might have in terms of how this program might fit you. But I think two things that I see are most likely to be very important for students who apply to this program. First one is be willing to work in the healthcare industry. What that means is not necessarily in the hospital setting, not in the clinical care setting, but looking at the tons of different areas, right? And looking at, from the service standpoint of view, it could be the imaging facility, could be the cancer care, setting, could be the ambulatory care setting, could also be in the pharmaceutical industry, could be also in the medical device development, so on and so forth, right? And so I do not want to, just saying, well, you have to work in the hospital setting. No, that's not the case, because hospital only counts for certain percentage of healthcare. That a lot of different supporting function roles, in order to deliver care to patients, right? And so so the first one, as I mentioned, is be willing to work in healthcare, because this is a very important industry, and what we are doing really matters, because if you do things right, you save people's lives, right? And the second one is really be able to develop all this analytics mindset, right? And so previously, our prior program was more focused on executive management training. So those type of program were more focusing on, well, how you be able to managing things, how you be able to assume leadership positions. Those are still very important characteristics from general business perspective. However, in our current program structure, we want to really help students to develop the analytic mindset, so that by the time, they're going to the job market, they're going to the interview, they're actually looking at the first position, they'll be able to come in looking at the data, working around the data, collaborating with the data scientist and as well as the stakeholders, drive some data-driven solutions, right? And develop some of the solutions that might help make the business change for better, right? So I think that is one of the things is very important as well. Unfortunately, we have a few occasions where some of students joined the program, but eventually they're starting to learn the program, starting to feel this not exactly what they wanted for. Which I think I have one case like that out of probably a few dozens. So, but I just want to make sure that you understand, willingness to work in healthcare, very interesting getting to healthcare, at the same time, a willingness to develop analytic mindsets, right? And combine those two, that will be very important indicator of how much success you might be able to drive in your career. Okay.
I had a couple of questions, if that's okay.
Sure, go ahead.
Yeah, so just to give you a brief background, so you know where I'm coming from. I'm a physician at a hospital. So in your experience, I know you said the programs are relatively new. How many, and so I am involved in a lot of, the reason why I got interested in this webinar and program in general is because I'm involved in a lot of quality initiatives, project management type issues in the hospital. And, as you know, everyone knows the current environment is driving down costs, delivering better quality, efficiency. So the individual, I'm sorry, I didn't catch her name, but she asked about the more technical aspects of the program. I mean, do you find a lot of physicians, or not a lot, but like, is there some sample size that have applied to the program, and how relevant would that information be to their roles in project management in a hospital and whatnot?
Okay, that's a very good question. So I can tell you right now, we probably have, in terms of percentage, we probably have around 10%, well, probably close to 15%, a little bit over 10%, 15% are coming from specific hospitals, and those are including physicians and nurse practitioners, and in together. So in your situation, what I can tell you is just based on my exposure as well as my work with different physicians in the healthcare setting is, if you are willing to learn, I think that will make you a very unique MD or physician, and that bring up a quite different type of career path for you. So because I'm not sure what is your career objectives moving down the road, but most likely some of the successful careers that I saw, just from my exposure, there are quite a few of the physicians who are willing to take the challenge to, using the data and to better enhance the practices. And of course, right now you for the decision supporting tools, you guys, the CDS or CDSS you guys are using, is already a data-driven tools, right? And based on the patient information, the symptoms, and they provide you recommendation in terms of what might be the best treatment, but best probably even drugs to use. But built on top of that one, looking at the current challenge in VBP, right? Value-based care, as you mentioned, the quality improvement initiative, cost efficiency, that is a trend. That is the future we're moving to, no matter of what is going on, from the how to say, the president level, or from the whole administration going on. But I think there's no way for us to compete with others without really developing value, right? So I work with, I not work, but I keep close connection with Mount Sinai, with major clinics, with Intermountain, and with all the different other hospital systems in the nation. I saw how they be able to leverage data and to make a difference. Just for instance, for one example, where during the COVID, and a lot of hospitals, including New Jersey, struggling with not be able to see, what the future looks like, and not be able to see, well, how much supplies we have to have, not be able to see, how much patients, especially elective surgeries, is going to be disrupted, and because of this. And what have been done by some other leaders in this industry, be able to apply analytics, apply the data, they have been able to consolidate all those different informations and create those interfaces or those dashboards, so that rather to have to dig out the data, wait for hours, even days or weeks to getting the data, to get the information update, they're getting almost instant update in terms of what is the status quo for us right now. So that provide really a very unique competitive advantages for them to work around the business aspects, to playing on, what the service line that we need to focus on. And so in your case, if you're looking at the quality, the cost efficiency, right? And they have been able to really line up the data points looking at what are service lines that has making most of our profits, and what are some of the physicians that has had the highest outputs, the productivity, and what are some patients that complaints that has not been addressed very well, and what we should do moving to the next step. So I think that is the large picture. I think I saw a very promising, but I don't think at this current stage, I think current stage, most of hospital has not yet been able to get into that part. So that need to be driven by clinical person, not just be driven by IT person, as you know. Working with the EMR, for instance, right? We still hate to use EMR right now because it's not designed for professions, for healthcare professions. The workflow was not designed such a way to mapping with what we are doing clinically. So that is the problem. However, if some of the practitioners, healthcare professions can help to drive that change, that will make a huge difference. So that will, of course, I know it's not your comfort zone, because for clinicians, nurse practitioners, physicians, you guys are trained to treat patients, to take care of patients. You're not trained to manage data. But just think about what is the potential if you can just add a little bit of that analytic components to your current profile, and to make a difference. And that will, I think, I keep telling some of my physician friends and some of physicians I worked with the importance of developing this. I'm also working with medical schools with Rutgers, and I work with the associate dean, and they're also thinking about for the next generation of medical students, be able to understand the data, be able to walk around the data, and will be some of the future movement that the medical school needs to consider as well. So, but I give you a long answer, but I just
No,
feel
that's basically is very helpful. That's what I was looking for, because it's all about it's like the value-based payment system. I mean, reimbursements are all driven by what you're talking about. So, the whole reason I just wanted to kind of get an idea if there's like actual physicians, because like you said, it's out of our comfort zone, but it's kind of daunting to get into stuff that may not be entirely relevant. But I think you answered my question that it is.
But very good question. But I think also, since we have students from different backgrounds in the program, we try to customize the curriculum for them, because I think for physicians, it does not make sense for them to do the same time programming as a data scientist, right? But however, if you are able to learn some of the analytic skill sets, be able to understand the process to get into that results, right? And so that will be totally different, right? You kind of create the mindset, right? And so that in the future, as you're working on the data, probably working with the team, and you will be able to point out, this does not look right, right? And what we need to do to fix this, what we need to do to correct this. Right. If you don't have that training, then essentially, unfortunately, we do also have physicians has been struggling with that in the program. I'll be upfront with you. We have physicians who are really hands-on, really appreciate this, but we also have physicians who don't think this is the right fit. Okay, I can tell you upfront. But I think what we're trying to do right now is to customize curriculum in such a way that try to pick up the courses that are going to be most valuable for each individual person. Now,
you might have touched on this on a prior slide, so sorry if I missed it. But did you mention the cost, or like how much what is the tuition that will be charged?
Okay, so the tuition, I want to make sure I give you a right number, but for I'm looking at the website right now. So for the tuition, for the in-state tuition, and for is each semester for 12 credits is roughly around $14,000. Okay, and for international students, I think it's just we are looking at what was the number? Okay, I think for international students, it was out of state. It was $24,000 for 12 credits per semester, but for part-time students, the tuition per credit is $11,000, around that number, without considering their other fees. So that's kind of the tuition that we're looking at. If you're working with a hospital system or IDNs, I'm not sure with the you guys are affiliated with Rutgers or you're part of Rutgers. If you are, I think there's some of tuition agreement as well. But you probably want to ask your administrators to see whether there's any existing agreement in that regard.
Sure. Thank you.
You're welcome. So okay, I have a question from the chat box. 3 years of experience, recommendation from manager, not in organization anymore. Yeah, so if you, we don't, well, of course, we have to consider the situation. In your situation, Shwada, is that right? Did I pronounce your name right? So
Yep.
in your situation, it's okay. So if you want to use the previous manager recommendation, that's fine. Yeah, so in terms of coding,
So
yeah, in
I
terms of,
just had one quick question.
go ahead.
So actually, he will not be able to submit the letter of recommendation, but will I be able to send it through mail? So I have everything ready. His signature is on the letter of recommendation, but he will not be able to submit, but I can just forward it to you. Um, he has his own experience in the letter, but I can just forward it to you if you want to take a look at it.
Sure, yeah. If you want to send it over to me for evaluation, definitely, yeah, that can be done. So in terms of the coding experience, in terms
Yep.
of coding expectation, student would do what the very basic ones we use in Excel, okay, but that's not what we only use. And so you're going to learn R and Python through the program. That is expectation for you to understand how this two program works, be able to do some simple coding in those two different languages. And then towards the end, I am working with our industry partners to co-teach the healthcare analytical course. We will teach students using Power BI from Microsoft to visualize the data. And we also expect students be able to follow some of the R codings to work around some of the data. Because what happens is when you are starting to practicing in the English profession, the data you're working on is not just some single spreadsheet anymore. It's not just hundreds of records or thousands of records. It could be millions, tens of millions, hundreds of millions records where Excel by itself would not be able to handle. And also Excel is subject to quite a lot of limitations. So that's why we're driving into this direction where students need to be able to read the data and do simple analysis of the data, be able to visualize the data using certain languages or using certain type of platform or software. But again, we are not expecting students to do heavy programming. We're not expecting students develop tens of thousands of lines of coding. No, that's not what we're expecting. But we do expect you to know how this program works, to do simple programming, and be able to read the code, right? And the simple code as well, because eventually you will need to be able to run some troubleshooting processes, and oftentimes that's something that you have to assume, right? So, but again, our focus is really the application, okay, and the application of analytics, and why this works, and how this data results tells you, and how we're going to communicate the results back to the executive members to help them to make a better decision, because those decisions are very critical, and those messages oftentimes cannot be cannot coming from their computer scientists, because they just do not know how to phrase it, or they do not know why this is important. Okay.
Okay. Yep. So the courses with R and Python programming, would that be mandatory or is it an optional course?
Those will be embedded in the different courses that you're going to learn through the program. So I would say that's considered as mandatory.
Okay, thank you.
You're welcome. Okay, still, I think we developed the program not just from scratch, but we are more looking at the industry trends where what industry is struggling with and what data analytics professions might help to address the issue, solve the problem. So that's why I think R and Python, in general speaking, to have exposure. So I think I want using the term of exposure, right? Be able to exposure at the minimal to those two languages, understand how they works, and to do some simple programming. And I believe for those courses you're going to taking and you're going to have the time to learn, you're going to have the example to practice with, and the faculty members will help you to go through the process. But have the mindsets, right? Develop the analytic mindsets is very critical, because if you cannot deliver results, deliver solution, then that's going to be very troublesome. And because people count on you as an analytic profession to be able to deliver something, right? So, okay, so let me see, might have another question. Yeah, right, good question. So our program is New Brunswick based. So I would say over 90% of the course, or 100% of course will be delivered through New Brunswick. And some of the course you might be able to take in Newark. All right, and if there are some of the different sessions offering for those subjects. So yeah, I did not mention that. So our for the for the coming spring semester, and of course the application deadline for domestic students for spring semester is the 2nd of January. If you are interested in start at the right now is the you have to speed up. Okay, otherwise the fall semester starts, the regular fall semester starts in the 2nd week of September, and application deadline for the fall semester is August 1st. So if you want to join the fall semester, that's fine as well. So for all the courses for the spring, I can talk about spring right now. I don't know what is going to be the next fall semester. Spring 2021, most of the course will be online. But we also have starting to offer a few courses in hybrid formats, because as a business school, I think a lot of times those type of building the social network, establish a social connection is best done offline. Of course, we still have to stick with the social distance and wearing masks and so on and so forth, but we're going to try to offer a few courses in hybrid format, not 100% offline. Hybrid means 50% offline, 50% online. Okay, so we're going to start to test some of the courses in hybrid format. And but I think what we learned from pandemic is we probably cannot require everyone to join offline if you're not comfortable with, or if you have working schedule conflicts. So we will try to accommodate. We probably will also, during the offline, in classroom sessions, we're probably also going to hook up Zoom and to broadcast the course real time as well. I think technology-wise, we are our IT group already developed those platforms, so we're not going to be having any trouble with that. But I cannot say what is going to be for the fall 2021 at this moment. But my guess is we're going to provide more flexibility. But the reason for us not to go to online is we'd not start with online program. We feel that especially for healthcare professionals and for students with all different backgrounds, to have this meaningful conversation is very critical. So one of the very important aspects I have a few, if you I have a few minutes, so we're going to stop very soon, is students join the program from different backgrounds. We have physicians, we have MD, we have nurse practitioners, we have seasonal analytic professionals, and we also have people working in the supply chain and other healthcare service or in marketing and so on and so forth. So a lot of those conversation that we're driving in classroom is not just you listen to the professor, you answer professor's question. That's not the business school, that's not the graduate school. Rather, it's more we develop all this discussion. We have this conversation among ourselves to have each one contribute to the discussion. So we learn all together, right? And because if you think about it, if you're not healthcare professionals, but you sit next to a physician who just finished a shift, right? Or morning shift or night shift and join in a class and listen to what he or she has been going through and the struggle they have in the hospital, or listen to other health analytic professionals, even though it's non-healthcare, but hearing what they have been working on analytically and what kind of the software they have been using, what has been working well, what has not been working very well. Having all those different perspectives coming into a classroom, enjoy the conversation, those dialogues. That is the part that online courses cannot beat. Okay, that is the dialogues that if you join some other different schools, you might not be able to get. Okay, so that's something that I want to foster in the program. I want to keep on developing this program where by finishing the program, each of you guys becomes one of the best buddies for each other and through all the teamwork you working on, the team projects you're driving. And so that's another aspect for us looking at from business school standpoint of view. So most of the course, if it's offline, it will be either from 6 to 9 or 6:40 to 9:40. So that's very common for business school. And some of the courses might be offered during the daytime, but those are very few, okay? And we probably have, out of them, there 36 credits or 12 courses. We probably have 2 or 3 courses that can be taken online. I would say around 5 courses or 6 courses previous has been designed as a hybrid formats. And then the rest courses has been designed in offline format prior to COVID, okay? But moving forward, I would say that we are going to have more flexibility. So we will try to accommodate students as well, okay? All right. Any other questions I might be able to answer? All right, well, if no questions, thank you guys so much for joining today's session. I enjoyed talking with each of you. I hope the information is meaningful, is helpful. And I wish you guys have a good start of your application process. If you are continuing interested in this program, I hope this unique program will fit with you and meet your requirements or your future demands and for different graduate program. And wish you guys a very Merry Christmas and Happy New Year. And if I'm going to keep continuing to talk with you guys for any questions or issues you have, feel free to email me, and my email address is over here. Or okay, and otherwise, that's pretty much for today. Thank you. I'm going to send the recording for today's session as well as a recording for last time, because last time we have alumni and another faculty member join us for the open house. We have also some other discussion as well, and feel free to review these videos at your free time, okay? All right, with that being said, that's pretty much for today. Thank you so much. All right, bye for now.